this is Kaylee. I'm going to be demonstrating how to do a CVAD dressing change today, as well as how to do lab draws from a CVAD. So the first thing I would do before even entering the room is I would gather all of my supplies. I would check the doctor's orders. I would verify the patient, make sure there's no contraindications, get everything together, and I'd get ready to go in the room. So now when I enter the room, I'm gonna knock. I'm gonna close the door behind me and close curtains to provide for patient privacy. Good morning, sir. Can you tell me I'm Kaylee. I'm gonna be changing your CVAD dressing today. Can you tell me your name and date of birth? And I would check, and he was John James, 12/20/2000. Fantastic. I'm gonna do hand hygiene over here. So we're just changing this dressing today. It just helps prevent infection. I'm gonna check it while I'm changing, make sure it's not warm, no drainage, no any signs of infection, any problems. Do you have any allergies to latex, antimicrobials, anything like that? No? Fantastic. All right. So do you have any questions about the procedure? Fantastic. All right. So I'm going to give you this mask. I'm going to have you put this on. I'm going to have you turn your head away from where I'm working here, and I'm going to put a mask on too. All right, now I'm going to put on clean gloves. And then I have a trash can placed close by to discard things. So I'm just going to start, sir, by removing your old dressing. We're all stabilize. I'll find an edge. Would you off to? Perfect. Then we're going to discard that. All right, I didn't note any redness. There was no pain, no drainage. So I'm going to take off my old gloves. I'm going to discard those. We're going to step over here and do hand hygiene again. Now we're going to get ready for the sterile part. So we're going to open my containers away from me. Now I'm going to put on my sterile gloves. All right, now I'm gonna have all my stuff ready in my container. Nice and open and ready to grab. I'd also open a skin protector, which I don't currently happen to have. All right, sir. So we're gonna start by cleaning. I'm gonna take my ChloraPrep, and we'll stabilize, and I'm gonna do circles out from the site. We're gonna wipe down and around these tubes as well. Perfect. And I discard that. All right. We're gonna let that air dry a little bit. Then we're gonna go ahead and we're gonna put your this hand was dirty, and I know that. I would have just picked this up from in here with my still sterile hand. And we're gonna get ready. I'm gonna stabilize here. We're gonna use sterile hand to put this on. Perfect. All right. Now we're going to take the already open skin protector and wipe that around the edges. And we're going to grab our Tegaderm. this. And we're just gonna put this on over top. We're gonna try to make it smooth out towards the edges, especially because it's gonna be in his neck crease and it's gonna be a little uncomfortable.
I have to talk real loud to him anymore.
All right.
And he still don't understand half what I say.
We're gonna remove this edge. All right, now we're gonna take this little strip. I would get my pen, I would put my initials, I would put the date and time that I did the dressing change. And I'd go ahead and take this little strip and label my dressing change. All right, so now most of our sterileness is over. So we're gonna go ahead and change our caps. We already have these opened and ready to go for us. So I'm just gonna take our new cap, remove this, and take our old cap off. Gonna put our new cap on. And before we had even started this procedure, we'd have made sure these were all closed. I've already run through this a couple times, so I knew they were closed, but we would have checked that before starting. Now we would take an antimicrobial wipe off this hub. We would take our saline flush. We would attach and we would unclamp this. We would flush, make sure there's no resistance, no problems. We'd remove this, take our heparin lock, and then we would flush with our heparin, remove, and then we would add a new clean, not used orange cap, but since I don't have any, we're just using this for example. Then we would reclamp our line. And then we would repeat for all of the caps on that CVAD, depending on how many you would have. And that would be our dressing change. Now, if I also needed labs from this patient, I could have gotten in the middle of all that, but for simplicity's sake, we're just gonna walk through it now. So I would have checked my order before I came in. I would gather up all my tubes, all my flushes, heparins, clean syringe, needles to put the blood into the tubes. Come in, I would go through the whole introduction, explain what I'm getting labs for. I'd re-identify my patient, make sure the patient doesn't have any questions about the labs. So then I would go and I would remove the antimicrobial cap. I would cleanse the site with an alcohol swab again. I would flush with saline, and then I would draw back blood. I would then discard that tube of blood. I would get a clean syringe that has never been used. I would attach that and I would draw back my blood. I would then use a vacuum pump or a needle or however your facility likes to transfer blood to the tubes. I would transfer the appropriate amount of blood into each tube. I would set those to the side for a moment. I would reflush with saline, flush with a heparin lock, and then put on a new orange cap after I had collected the blood. I would then go to my computer. I would scan the patient's wristband. I would print off my labels. I would label each of my vials while I am still at the patient's bedside. I would put them into a biohazard bag. I would clean up all my stuff. And before leaving the patient's room from any of these procedures, I would make sure he didn't have any questions afterwards, ask him if he needed anything before I left. And I would tell him I would be back in about an hour to check on him. I would then go and I would send my labs to my blood draws to the lab. And I would document the procedures, whether it's the dressing change or the lab draws. Then I would go check on my next patient. Thank you